We have with us today Dr. Syed Zahid Raza, a consultant urologist at Santosh Hospital, Kolsbach, Bengaluru. Dr. Zahid has a keen interest in endourology. He is a council member of Bangalore Urology Society and also is a member of the youth wing of Urology Society of India. Welcome, doctor.
Thank you, Ranjitha.
Well, you all must have heard about kidney stones because more than 1 in 10 would have had stones at some point in their life. And also you must have heard people saying the pain caused from kidney stones as equivalent as during the childbirth. But do you actually know how these stones are formed and how to prevent them? Let's find out from Dr. Zahid.
Hi, first of all, I would wish all the viewers a very happy new year. May this new year bring more joy and happiness and less of sorrows and miseries. To start, as Ranjitha rightly mentioned, kidney stones are one of the common conditions we see in our day-to-day practice. And what are these kidney stones? For that we need to understand what is a urinary system. Okay? The urinary system is divided into the kidneys where the urine is formed, the ureters or the tubes which transport the urine from the kidney to the bladder, and the bladder where the urine is stored until and unless we find a specific place suitable to pass the urine out. Now we also have to understand that there is a complex mechanism of filtration and complex mechanism the way in which the kidneys filter and reabsorb certain essential components. Now this mechanism is any change in this particular mechanism wherein there is excessive solutes or salts which are produced in this in the urinary system get deposited within the kidneys, and they form crystals or aggregations of these salts to form kidney stones. Now just to give an idea why filtration is so essential in a human body, kidneys usually produce about 180 liters of urine per day. Imagine having to pass that amount of urine per day. You have to spend most of the time in the bathroom. So there's a beautiful mechanism by which the kidneys reabsorb what is important to the body and excrete what is the waste. And now during this process, any problem which will cause an increase in the solute, or if there is decrease in the solvent, that is if there is decreased water content, or change in an internal environment, will cause the stone formation.
Doctor, the mechanism of the formation of kidney stones was really interesting. Now, who are at an increased risk of developing these kidney or renal stones, doctor?
People who are at increased risk are those people who live in hot, dry and hilly terrain or hot and dry and humid conditions, wherein there is more possibility of losing excess body fluid. People are also at risk who do not drink water. Those people who do not drink water are at very high risk. And also there are certain conditions like where anatomical abnormalities, like any form of an obstruction in the urinary system, will lead to secondary stones as well. For example, if there is an obstruction in the ureter, the proximal portion, there will be stasis of urine which will result in formation of secondary stones. Similarly, in the lower urinary tract, if there is an obstruction, there will be stasis of urine in the bladder, and that can cause bladder stones as well. So other than this, there are hereditary causes as well. So there are hereditary causes because of which one might get kidney stones. So kidney stones, people who have family history of kidney stones are more likely to develop kidney stones.
Oh, are kidney stones hereditary, doctor?
Yes, to give a broader perspective to this, the overall incidence of kidney stones is about 9 to 10%. Now in that 9 to 10%, about 40% of them have family history. So that means that kidney stones do run in families. There are certain conditions which run in families, like hypercalciuria runs in families, and there are other complex metabolical problems like the renal tubular acidosis, and also cystine stones are supposed to be hereditary, are meant to be hereditary. So definitely kidney stones can be hereditary.
Thank you, Dr. Zahid. for enlightening us about kidney stones being hereditary and it can run in families, because I really didn't know this. Now, my next question to you is, are there any types of stones, or there are any different types of stones actually?
There are different types of kidney stones. To just broadly summarize these different types of stones, they are divided into stones of calcium salts. That is, they can be salts of calcium, which is calcium oxalates, calcium oxalate monohydrate, calcium oxalate dihydrates, calcium phosphates. Second type of stones are the commonest. I am talking about from the most commonest to the next common stone. Second is the struide stones or the infective stones. These are also called triple phosphate stones. Now, triple phosphate, the name comes because these are stones of which the composition is calcium, magnesium, ammonium phosphate. Hence, the name triple phosphate stones. So, the third is the uric acid stones. Okay, it's the composition is uric acid. Fourth type of stone is the cysteine stones. Okay. And the fifth is broadly classified into others and some drugs causing these particular stones. So there are different drugs which can cause some certain particular type of stones.
Doctor, you mentioned about medications, leading to stones, but can actually medicines cause kidney stones?
Yes, there is literature stating that there are certain drugs which can cause stones in different ways. To give an example, people on Indinavir, which is a drug for a lot of HIV patients will be taking that particular drug. This drug causes crystals to form and which are released in the urine, and they can get impacted in the ureter. A very peculiar thing about this particular stone, the crystals of Indinavir, is that it does not get picked up even on a CT scan. So this is the only stone which does not get picked up on a CT scan. Other drugs which can cause stone formation is few antibiotics like ciprofloxacin, sulfa drugs, they can cause stone formation. And also few loop diuretics like furosemide. All these also can cause stone formation. Although the mechanisms might vary, but there has been literature which shows that these drugs can form stones.
Doctor, this is one of the basic questions. What are the signs and symptoms of a stone disease?
See, the most commonest symptom of a renal colic or a ureteric colic or ureteric stone is pain. Okay, it's called ureteric colic. Now, the characteristic about this pain is it's severe pain, and like you mentioned in your introduction, that it equates to a childbirth or the pain which women experience during labor. Severe pain, the characteristic of this is it can be episodic, it can last for about 3 to 4 hours. Sometimes it is only relieved after taking some injectables. But another important thing is it is associated with vomiting, and it can sometimes vanish as if nothing has happened. So this sometimes can make the patient complacent. So you have to understand, if you have this particular type of pain, you should visit, even one episode, you should visit the doctor and get yourself checked for a renal stone or a ureteric stone. Because what happens if you don't get yourself investigated is you will be complacent, and after about 3 months the whole kidney can be destroyed. Okay, so it stops functioning, not destroyed, it stops functioning. So to prevent that, it is absolutely necessary for you to consult your doctor. The other symptoms are like passing of blood in the urine. So now that can cause severe anxiety and stress, because it's very difficult for a person to see blood in the urine. It can happen even in the absence of pain. Okay. So now blood is because of the irritation of the stones to the mucosa. So because of which there will be bleeding in the urine. Other common symptoms are lower urinary tract symptoms, especially for stones with lower half of the ureter. Like urgency, patient has to run to the bathroom, will not be able to hold, but frequency, they have to go to the bathroom quite often, but when they go to the bathroom, they will not be able to void. Okay, so all these symptoms are very few common symptoms of stone disease.
So doctor, you mentioned about investigations, for a patient. So can you tell us about different kinds of investigations to diagnose kidney stones?
See, basically these investigations I would broadly classify into blood investigations and your urine investigations and your radiological investigations. Now in blood investigations, you would get a total count or CBC, complete blood picture. Now what it gives us is an indication whether there is an added infection because of the stone. Your total counts would be raised, and also some other specifications which we look into. Other than complete blood count, we always prefer to get two other tests. One is your serum electrolytes, to see your sodium, potassium and chloride levels, and also you see your RFT, that is your night urea, and also serum creatinine. This gives us an indication of the functionality of the kidney and whether the pre-existing stone is hampering this functionality. So these are the blood investigations. Urine investigations, you would get urine routine wherein you look into the presence of blood or infection again, and also it gives us an indirect evidence whether the stone might be there, that is the presence of crystals or casts. And also we would get a culture to see what organism is growing. And other than the urine and blood investigations, there are radiological diagnosis. Now radiologically, earlier days they used to do X-ray and IVPs. Now as the technology is advancing, we have good ultrasound machines and also excellent CT scans. Presently, I would say that CT scan is the imaging modality to precisely and perfectly investigate a kidney stone.
Is doing a CT scan actually mandatory in all cases, doctor?
I wouldn't say it is mandatory, but given the investigation modalities what we have, the radiological modalities, like I said, earlier days we used to do something called the IVP or the X-rays, and then we started doing a lot of ultrasound to pick a lot of kidney stones. Ultrasound is an excellent modality to pick up kidney stones, but there are certain lacunae. We have to understand that CT overscores ultrasound in many ways. Now to give you an example, ultrasound might not pick up some stones which are less than 2 millimeters in size. Sometimes it is difficult to identify a stone in the ureter when there is gaseous distension, when the bowel loops or any other anatomical structure coming in the way of the ureter. And also CT gives us additional information about a lot of things which will help us plan our treatment. For example, a CT will always give you the right anatomical mapping. You will know exactly as to how many number of stones there are. You will know what positions they are placed at, and also you will know the Hounsfield units. The Hounsfield units is a measure of the hardness of the stone. Now, if the Hounsfield unit is more than 1000, certain treatment modalities will not be effective. If the Hounsfield unit is less than 1000, the options open up. So that is why CT scan is necessary, and it does overscore ultrasound in many ways. Presently, CT scan is the investigation of choice to investigate and treat renal stone. Help us treat the renal stones, renal or ureteric stones.
So doctor, how would you treat a person with kidney stones?
Okay, so the treatment, I would broadly classify it as medical management and as surgical management. Treatment does not include prevention. Prevention is something different. Treatment is treating the stone. Now, the stones can be treated in two different ways: medical management as well as surgical management.
So doctor, what are the different types of medical management followed?
Okay, so to broadly categorize these patients into three groups. Group 1, according to their size. Okay. So group 1, stone less than 5 millimeters. Group 2, stones in between the range of 5 to 8 millimeters. Group 3, more than 8 millimeters. Now there have been enough number of studies saying that less than 5 mm, the chances of stone passing out spontaneously without an intervention, okay, be it medical or surgical, is 90%. So usually for less than 4 mm they pass out spontaneously. Second is the group wherein the likelihood reduces. Okay, between 5 to mm, there is less chances of the stone passing out spontaneously. So for such type of stones, we might add on something to help the stone being pushed into the normal passage. Few very distinct medications what I can think of is one particular drug what you use is alpha blockers. Okay. Now alpha blockers, what it does is it relaxes the smooth muscle of the ureter, especially in the terminal portion. So it dilates so that it, if necessary, the 5 to mm range stone can push itself out. Okay. Other than alpha blockers, we use a certain drugs which are high in inhibitory substances like citrates, so potassium citrates especially. So we have syrups and as well as tablets with potassium citrate, and there are other drugs which we need to specially mention as painkillers. So pain being the most significant symptom, we need to make sure that the patient gets adequate analgesia. But before taking a painkiller on your own, it's better to discuss it with with your doctor, because there are certain drugs which are harmful to the kidneys. You should avoid these medications. All the medical management, you sit with your doctor, sit with your urologist and discuss with him, and then you can take it forward from there.
Doctor, with so much advancement in medical management, can kidney stones be removed without an operation? Is operation necessary or?
Okay, so this is another common question which I encounter in my day-to-day practice. So when a patient comes to me and he would have also visited so many different doctors, not only allopathy as well as other forms of medicines, they would have told the patient that okay, it's possible to dissolve a particular type of stone and remove it without surgery. It is possible only in few types of stones. Like for example, uric acid stones, because uric acid is a low pH stone, it's acidic. So you make the environment into alkaline by giving him an alkaline environment, and that results in dissolving of the stone. But otherwise, the most common stones like calcium stones are difficult to dissolve or make them vanish without any form of treatment. And the second thing is, without surgery, there is one particular treatment, I think I've spoken about it. It's called ESWL, extracorporeal shockwave lithotripsy, wherein there is no surgery involved. The patient just lies down on the bed, and through external shocks we can break the stone. So, but there are indications for that. There are particular types of stones and the size of the stone which we have to deal it with that way.
So doctor, what are the absolute indications for an operation or a surgery?
To answer that, I would just briefly tell you about what are the different options we have in treating the surgical options we have in treating the kidney stones or the ureteric stones. See, what you have to understand, the term surgery, when thought about it, say 15-20 years back, it means you put an incision open, it relates to more open surgeries. But as the technologies have advanced, we have very minimally invasive or least invasive procedures. For example, a stone in the ureter can be treated in different ways. One, you can pass a ureteroscope, which is a semi-rigid ureteroscope, and go to the stone and fragment it using different energies. Like you can fragment it using an ultrasonic energy, you can fragment it using a ballistic energy, and also now we have lasers at our disposal, which are excellent machines, which gives us an ideal clearance of the stone. So ureteroscopy for a ureteric stone is very minimally invasive. There's not going to be a cut which is going to put, we are going to put, and we are just going right through the normal natural passage to the stone and pulverize it. Few stones in the kidney, depending on the size, can either I can either do an RIRS, wherein we pass a flexible ureteroscope which can turn both ways, this way and this way, and we can easily visualize the stone within the kidney and break it using the laser. Now there are certain indications wherein we have to puncture the kidney and remove it. It's called PCNL. Now there are advances in PCNL as well. There's very minimally invasive punctures what we are going to do. It's called MIP and ultra mini. There are a lot of modalities wherein the puncture of the kidney is as small as a needle also. So we are able to clear the stones with puncturing of the kidney as well. So there are different modalities of treatment of renal stones when it comes to renal and the ureteric stones. There is another modality called the ESWL, wherein it has its certain indications, wherein a patient, it's an OPD procedure, patient lies down on a table, there is a machine which comes and localizes the stone using an ultrasound and an X-ray, and it gives shocks. Okay? So it gives shocks and that pulverizes the stone. So these are the different modalities of treatment. So the absolute indications when the surgery has to be done is when the patient is spiking fever. Okay. So when the patient is spiking fever, it means that the patient has some form of infection. When his renal functions are raised, that means that the stone is impacted and is causing some problem to the kidney. It has to be removed. When the pain and vomiting are not relieved by the symptoms, the pain is severe. So that time also the patient can ask for and can undergo the procedure, which will have an immediate relief.
Thank you for informing us about the different kind of surgeries done regarding kidney stones. Now, doctor, do kidney stones relapse or recur again?
This is a very good question, Ranjitha, because most of my patients, the first doubt what they have is that, doctor, once we undergo the surgery, once you remove the stone, will the stones not recur again? Is it a treatment for life? So, to explain this, I put it in a very simple manner. What we are removing is the end product, that is the product of the kidney. Okay, so we are removing just the end product and we are not removing the organ which is producing these stones. Okay, so they have to understand that the way they got the first stone, they will again, there is a possibility of them having a second stone as well if they don't take the necessary precautions. So yes, kidney stones do recur and they do relapse if you don't take care of yourself and if you don't take necessary dietary precautions, they will recur and relapse.
So now that kidney stones recur or relapse, are there any home remedies that people can follow for to prevent kidney stones from forming again?
Yeah. So about home remedies, a lot of my patients come, they sit and discuss with me. These home remedies, more than us telling them, they would have already taken it. Okay, so they come and tell us, doctor, we have taken barley water, we have taken bamboo shoot water, can we continue taking that? So for that, I would definitely say yes, there is a beneficial effect of these homemade remedies. The way they act is, they cause diuresis when more amount of urine is produced, and they have inhibitors of stone formation like the citrates. So they are high in citrates and inhibitors of stone formation. So there are home remedies which patients would have already taken, like for example, I just gave two examples, that is barley water and bamboo shoot water. There is a beneficial and definitely there is a role of dietary precautions taken by the patient to prevent.
So doctor, you mentioned diets, right? People have to follow some dietary regulations. So what diet would you recommend for people to follow who have already had kidney stones?
Yeah, that is also the one of the most important aspects in treating the kidney stones, because most of them ask me what diet to follow. Now, kidney stone is an age-old disease. Okay, so there are a lot of papers published about different diets which are responsible for stone formation, and different diets which help in inhibit the stone formations. So, but for me, I have just broadly classified into a few important things which you need to follow to prevent the stone formation. The first and foremost important aspect is drinking a lot of water, hydrating yourself. You drink a lot of water, you prevent stones. It is as simple as that. Second most important is reduce your protein intake. Most of our stones are either calcium based or uric acid. So high protein intake is a risk factor for both these types of stones. Now third is the salt. Salt is actually like a catalyst to it attracts all these things, binds them together and then causes crystals to form. So salt is also an important substance which you have to avoid. Salt as well as high salt containing products like pickle, which is actually good for your body if you avoid in all other ways other than kidney stones as well. So drinking water, meat intake and your salt restriction. So now there are other dietary specifications like tomato seeds and then your spinach and then your cocoa and then chocolate, and all these things are rich in oxalate. So you should avoid these products, dairy products. You should try avoiding these products. By avoiding, I don't mean that you necessarily have to stop. See, your body needs certain amount of nutritional value. You can take that in a specific and a nutritive way. Okay, so you don't need to stop them, but if you really need to stop, avoid meat intake and avoid salt and drink a lot of water. like I said, drink a lot of water. So I'm specifying drink a lot of water because it is that important. Okay, and protective fruits or vegetables, if I have to give some example, is like the banana, the citrus fruits, be it oranges, be it lemon, lime, all the citrus fruits. Then you have your papaya and safely eaten fruits like apple, all those things you can safely have. So if you follow these dietary specifications, you will be able to cut down the chances of you getting the stone in the next 5 years.
That was really helpful, doctor. Thank you for taking us through about kidney stones, their causes, symptoms and treatment. I'm sure our viewers now know whom to reach and what to do when they experience the symptoms of kidney stones. Thank you again, doctor, for joining us. Thank you.